IDH1 is a metabolic enzyme that is mutated in a wide variety of cancers, and that means that it can be targeted for a wide variety of cancer patients. To talk about a new drug that does just that, we're talking with Dr. Daniel Pollyea, who is an MD and Clinical Director of Leukemia Services at the University of Colorado Cancer Center in Aurora, Colorado. Let's talk about this investigational agent. It's called Ivosidenib?
Ivosidenib.
Very good, thank you. Besides how to pronounce it, what do we know about it? You know, how many people have this particular mutation, for example?
Yeah, upwards of 10% of patients with AML will have a mutation in IDH1.
So the drug itself, it just essentially targets that particular place.
Yes, it's a very selective inhibitor of cells that have mutant copies of IDH1.
So in theory, it should be maybe a safe agent?
Yeah, I mean, I think the more selective these treatments get, the potentially fewer side effects they have, and I think that that's what we've seen in our experience with this drug.
So here at ASCO, you're presenting updated efficacy and safety data in the setting of relapsed refractory acute myeloid leukemia. So how many patients, what did you find?
Yeah, so what we're evaluating here in the abstract is 179 patients with an IDH1 mutation, relapsed refractory AML, got ivosidenib. And we're really excited that the overall response rate is around 40%. The complete remission rate is close to 30%. The duration of response is somewhere around 8 months. And we're actually reporting at this meeting for the first time that the median overall survival for patients who achieve a complete remission is actually 18.8 months. So really, for a relapsed refractory AML population, really exciting data.
So we should mention that this was a pretty well-tolerated agent. And studies in previously untreated AML, those studies are ongoing?
Yeah, so there's a lot of different studies ongoing for patients with IDH1 mutations in ivosidenib. There's upfront treatment setting in combination and with other agents, and then other combinations in the relapse refractory setting too.
So optimistically speaking, what do you think is going to come out? I mean, are you optimistic at this point?
I'm very optimistic. I think this gives us a new tool to use for patients with this mutation. It's an effective, well-tolerated therapy, you know, it's another treatment option that we have for our patients with AML.
And it's not very difficult to get the information as to whether they have that mutation or not?
Yeah, you know, I think that's going to be an ongoing challenge that will continue to be addressed as these drugs get more and more widely used and even FDA approved. If that happens, then it becomes incumbent on us and our pathology partners to make this testing available. And so, you know, if the demand is there because there's a targeted therapy that can benefit patients, then I think the field can figure out a way to get this information quickly.
So you've had some previous data presented, now you're here at ASCO. When do you think it'll be before we hear some more?
Well, I'm very happy to announce that as of this afternoon, this manuscript has been accepted in New England Journal of Medicine, and it'll be available online after the presentation. So you know, people will have access to a very extensive data set from that, and then all the other studies are ongoing and we'll be reading out as we go.
Obviously, to get the attention of the New England Journal of Medicine, you must be doing something right.
Yeah, I think we're on the right track. I think, like I said, you know, this is a really effective treatment option. It's a big advance in our disease with respect to, you know, the therapies that we have available for patients. And yeah, I think that's been recognized by our peers in the community.